Hello, how are you today? Good. Well, my name is Kevin. I am the Associate Curator of Artifacts at the Rutherford B Presidential Library and Museums. What that really long title means is that I get to handle all of the stuff in our collection. And I get to use those pieces, and we have 20,000 in our 20,000 items in our collection. I get to use those in exhibits to help educate the public in history. And so one exhibit we did in the spring and summer of 2018 is we did a medical exhibit called In Search of Healing. We have a very extensive collection of medical artifacts from the 19th and 20th centuries. And so we developed an exhibit around that. And so what I'm going to give you today is kind of a summary talk of the research that we did for that exhibit. And so kind of as a just a warning you up front, we deal with some squeamish topics in this exhibit, or in this talk. So some of the stuff is admittedly a little gross. I'll try not to be too graphic about things, but that is the nature of the topic. And as we go through this talk and you think, I just want you to think about what it was like for me to do in-depth research on this. All right, so for starters, let's talk about the medical profession. What existed as the medical profession? Well, the idea of going to a doctor is a relatively new idea. Doctors were generally whoever was one of the oldest persons in the community. Typically, it was an older female who tended to know a little bit about herbs or what healed and what didn't. Beginning in the late 1700s, though, we see this move towards a profession in medicine, where people are specializing, they're dedicating their lives to pursuing the study of the human body and disease. And in the 1700s, as doctors, people who are identifying themselves as physicians, become more interested in the human body, they start engaging in dissection of cadavers. And this became an acceptable practice for medical students. You see the beginnings of medical schools popping up, particularly in England and France. And as people continue to migrate from England and France to the United States, they bring this practice with them. In 1800, there are 4 colleges in the United States that could boast having a medical program. And but one thing that kind of rubbed the public the wrong way is, where do you get the cadavers? That's something to think about. And it became a rite of passage for young medical students to sneak into graveyards at night and dig up bodies. And so when the public got wind of this, the people were furious. They rioted in the streets of New York. 2,000 people rioted in what was called the Doctors' Riot in 1788. And because this put such a poor taste in the public's mouth about the medical profession, the United States is very slow to accept the idea of professional doctors compared to Europe. Throughout the 1800s, though, we do see more and more medical programs popping up. By 1900, there are 56 medical programs in the United States. But between 1800 and 1900, something happens in the United States, and that is mass migration of people from Ireland and from Germany. And those immigrants bring entirely different ideas about what medicine is. Today we would call it homeopathy, a lot of home remedies, more herbal remedies. And those doctors in the United States saw this as weird alternative medicine, not even really medicine. And it was very difficult for the general public to differentiate between a doctor who attended one of these medical programs and an immigrant doctor who is employing alternative medicine. So there's a push we need to regulate this profession. And so you see the birth of the American Medical Association in 1847. And the American Medical Association was largely created as a response to German and Irish immigrants. And it's stated in its initial founding to separate from professional and imitation medicine. So one place that is pretty common for us to visit is the pharmacy, the drugstore. We're pretty used to this concept. That relatively new in the 1800s as well. The picture here, if you're fairly local, this was Grun's drugstore, which was located in Fremont. What was pharmacy in the 1800s? Well, the number one thing that pharmacies would prescribe, and mostly it's what we would call an apothecary. You're taking herbal ingredients, you're taking certain chemicals, and you're mixing them up to create a drug. A lot of physicians did this themselves very early on in the 1700s, but in the 1800s we see a split. Physicians are specializing in diagnosis and prescription, and then we see pharmacists specializing in the mixing of the medication itself. The number one thing that pharmacists, doctors, and then pharmacists give to their patients is something called laudanum. Anybody know what laudanum is?
Well, they used it as a painkiller, I think. Maybe even no, I don't believe it was used as ether to knock people out, maybe not, but they used it as a painkiller.
Yeah, they used it as a painkiller. It's made of morphine and codeine. It's a derivative of opium, and it was highly addictive. We are familiar with this today through the opioid crisis. This was prescribed for everything. It was prescribed to children and infants. Nobody thought twice about it. Everything from a minor headache to a toothache was prescribed laudanum. The second thing that is most often prescribed is calomel. And calomel is mercury, essentially. Why are they prescribing mercury? Well, in 1800s medical understanding, disease and most of your health problems come from something called bad humors. So they had this belief that in the body there are good humors and bad humors, a good essence and a bad essence. And if you're sick, you've accumulated too much of this bad essence. And so if you've accumulated too much of it, we have to purge it from you. And so calomel was prescribed for its, quote, volcanic vomiting and explosive evacuation of the bowels. And it was prescribed for most issues. If you have a cold, if you have pneumonia, flu, arthritis, any of these things, you're prescribed mercury. And as we know today, mercury, causes madness, and it causes, it can cause mental effects. It can cause vomiting, diarrhea. People's hair would fall out. And the solution, if they observe hair is falling out and sickliness, prescribe more calomel to purge more bad humors. Another thing that is very often prescribed is just general alcohol. Whiskey, brandy, cough. It's used as cough medicine. It's used for headaches. It was used for broken bones. Everything you can think of was prescribed, or alcohol was prescribed. It was described as, quote, the most valuable sedative and hypnotic drug we possess for infants and young children. It's not that long ago that homes practiced this. If a child is fussy, if a child can't sleep, if a child has an ear infection, they're achy, you can give them a teaspoon of whiskey. That's not that long in the past. And to the right there, you can see an advertisement for cocaine toothache drops. Price 15 cents. That was a pretty common thing to see in the 1800s. So I mentioned we have this belief that we have bad humors and we have the good humors, and we want to purge out the bad humors. Well, one other way that they would do that is through something called bloodletting. And bloodletting is one of the oldest, most common medical practices in human history. It dates back to ancient Egypt, and we've been doing it ever since, with the idea being you're sick, you're sore, maybe you have some kind of mental disorder, there's some kind of bad blood. And so a doctor would come and pierce a vein and let out 10 ounces of blood, 20 ounces of blood, until the patient seemed better.
Didn't they at one time use leeches to bleed people?
Yes, they would use leeches as well as a more natural way of bloodletting. One thing, now when I'm done with the talk here, you're more than welcome to come and check out some things from our collection. What I have over there on the table is a Lancet set. It's a doctor's Lancet set from the 1800s, and it has different sizes of blades on it, whether you want to make a small incision or a large incision, depending on how much blood needs to be let. Now that question of, well, how much blood do we need to let is not really well defined. There's no standards, there's no reference manual. They have no concept of checking your blood pressure or anything like that. So it's really just kind of based on the doctor's best guess, doctor's judgment. And so, they figure that, well, whatever's wrong with you requires 5 ounces or 10 ounces, and they wait till that much is gone, and then they put a bandage on your arm, and they'll come back tomorrow, the next day, and if the problem persists, what's going to be the solution? We'll take some more until the problem seems to be fixed. This was one thing that doctors didn't really understand, is with massive bloodletting, they thought that if you're severely sick or if you have some kind of mental illness or behavioral problem, bloodletting is the answer. And so if you have somebody who's very, very loud or can't sit still or isn't following social norms, you bloodlet them. And if they pass enough blood, they're going to pass out, they're going to get fatigued, they're going to get sluggish. And their thinking is, oh, look, we've cured them. They've stopped that behavior that we've identified as a problem. One of the most famous cases of bloodletting, let me back up one second. The picture there on the right is a painting of bloodletting. And look at how casual this is. The guy's just reading the newspaper, having his bloodlet. You could go anywhere and do this, particularly the profession that gets associated with this. Anybody know? Barbers. If you've ever seen the barber pole with the red stripe around it. Barbers, you would go out, get a beard trim, get a shave, get a haircut, and let some blood out at the same time. I mentioned that the medical profession hasn't been established as its own entity. A lot of doctors are, and bloodletters are pastor/physician, general storekeeper / bloodletter, barber, bloodletter. So you couldn't make enough money as a medical profession just doing medicine. So you had some other profession to pay your bills. Now, one of the most famous cases of bloodletting occurs to George Washington. When he was 67 years old, he was out riding his horse in winter, caught strep throat, and his doctors came to him to treat the strep throat by bloodletting. And they took out 14 ounces of his blood. Now, to give you perspective, the average human has about 150 ounces of blood in their body. And when you go and donate blood, if you've ever done that, they typically take about 16 ounces in one of those sessions. So they come to him and they take 14 ounces of blood. He's still suffering from his strep throat. So the next solution is to give him calomel, the mercury for the vomiting and the diarrhea. He's still suffering from his strep throat, and so they bloodlet him again for 32 ounces this time. So if any of you who've given blood, twice that amount removed from him. So he eventually asks, they put leeches on him as well, and he eventually asks them to just leave him alone and let him die, which they do. But that is the tragic story of how President Washington ended up passing away, largely in a lot of pain. Now, if you're sick today, really sick, where do you go? Worse, you need more emergency treatment.
Emergency room or hospital?
Emergency room or hospital. In the 1800s, no, this is not the place you want to be. Hospitals were called houses of death, and they were largely reserved for the poor and the homeless. You did not want to go to a hospital, and if you had any kind of means, if you were middle class or upper class, you were able to pay for the doctor to come to you. You would not go to one of these places. These places are very cramped, they are poorly funded, they are not clean at all. And to go to one of these hospitals almost meant certain death. You're going to catch some kind of disease. There would be just these sweeping plagues of tuberculosis that would sweep these hospitals, smallpox, and they didn't understand how diseases are spreading. But if you go to one of these hospitals, you are probably going to catch something. Now, the thing that made people want to go there is they're free. Oftentimes they were operated by some kind of charity or religious organization, and so if you were poor and this is your last resort, you would go. But if you had the means, you would avoid going to a place like this. Now, if you can't afford to bring a doctor to your home, which was really expensive, there was kind of a second option, and it was called a voluntary hospital. What would often happen is a wealthy individual would purchase tickets for a nice hospital. It has they admit fewer patients, they're selective on who they admit. So if somebody clearly has smallpox or some contagious disease, they would not let them in. But if you were wealthy, you would purchase these tickets and give them to people that you thought were worthy. And in the Victorian era, they had a concept of worthy and unworthy poor. If you were a drunkard or a gambling addict or a prostitute, you were the unworthy poor. You deserved to be in that situation in their view. But if you were somebody who, your farm burned down or, your factory closed up, you were just out on your luck and you were worthy poor, and the benefactor might give you one of these tickets to go to a nicer hospital. So the hospital is the last place you want to go to be treated medically, but the very, very last thing you want to have done to you while you're there is to have surgery. Surgery at the time, most doctors that did surgery, they kept themselves restrained to pretty much topical things, removing moles, certain growths, that type of thing, extracting tooths maybe, some kind of dental work. They didn't want to go inside the human body because if they penetrate too deeply, infection sets in, and they had no method of treating that whatsoever. So you avoided that as much as possible. But sometimes, invasive surgery is required. And so surgeons would have to do this. And so this is the part where it's going to get very uncomfortable. So one common procedure that had to be performed fairly regularly was amputations. People who worked agricultural work or early factory work, any kind of cut or nick, our hands get beat up, we don't really think much of it. We maybe pour some disinfectant on it, put a bandage with antibiotic ointment on it, and we go about our day. In the 1800s, you had to be concerned of, I snagged my hand on a nail. Well, that could turn into gangrene very quickly. And the solution to that, because we can't treat the gangrene itself, is amputation. And that was the number one surgery that was performed. And they don't have anesthetic yet. And so what that means is literally the doctor, the medical team, most of them have to hold the patient down to keep them from running away. They're, of course, screaming very violently. Doctors, these surgeons who would perform these, if you were a good surgeon, that meant you were a fast surgeon. You could get in and out and, keep the pain to a minimum as best you can. The doctor who was known as the fastest surgeon, so there's kind of like the quick draw in the West concept. The surgeon with the fastest knife was a man named Robert Liston. He could amputate a leg at the thigh in under 30 seconds, which is insanely fast. He invented his own knife to do this, to expedite the process. That's called the Liston knife up there. There is one of those in this kit that I have. Just kind of a piece of side trivia. Jack the Ripper, you're familiar with the murderer Jack the Ripper. The weapon that he used in almost every one of those cases was the Liston knife. That is part of the reason why everyone believes that he has surgical expertise in his background. One thing, though, that does revolutionize the profession is anesthetic. Ether is invented, and it's first employed in the state of Georgia in a dental procedure in 1842. And so they get a rag, they soak it in the substance of ether, and they cover the person's mouth, and the person goes unconscious. And when they did this procedure on the person, the guy wakes up and asks the doctor when they're going to begin. And so a medical journal at the time says, "We have conquered pain." And so the thinking there is, okay, well, we've solved the problem of pain. We can put a patient under, and they're not going to experience all this horrific pain while they're enduring surgery, which means the doctor doesn't have to go as fast as he possibly can to get the procedure done. So that means the doctor can be a little more accurate, take his time. You would think this would improve conditions, but it actually makes them worse. Surgical mortality rates go up after we develop anesthetic, because doctors are now more brazen. They're willing to go inside and operate on a gallstone. They're willing to go inside and maybe do some kind of cardiovascular operation, which means they're in there tinkering around for a long period of time, and the body is getting exposed more and more to infection. And to give you an idea of the sanitation of this, doctors, they didn't clean their instruments between patients. They had no idea that you had to do that. Doctors often would put their equipment in their teeth and so they could work with both hands. These conditions are horribly lit. There's no lighting in the room. We don't have electric lighting yet, so there's a guy holding a candle, and that's all he can see is that candlelight, and it's dripping wax everywhere. It's incredibly unsanitary. So it's actually making things worse, the fact that they don't have this motivation to get in and out as quickly as they can. I told you it was going to be rough, right? During the Civil War, medical technology or medical practice at the time is going to get tested in an entirely new way. There is one kind of common misconception about the Civil War, and that is the idea that wounded soldiers, you get a shot in the arm, you get a shot in the leg, you have to get amputated, which was common. But there's this myth out there that they had no anesthetic and they're just giving these guys whiskey and bourbon and hoping that helps a little bit and then performing the procedure. That's not true at all. Ether had been used for 20 years at this point, and the Union government stockpiled it. And so ether was very regularly used during the Civil War. So these soldiers who are wounded are unconscious while these procedures are happening. But this does take medical practice and put it on a larger scale than ever before. There are 21,000 Union soldiers that lose their limbs over the course of the war. And many of them, and there's a picture of some of them here on the right, many of them opt to use some kind of prosthetic. So there are 133 patents that are filed during and just after the Civil War for prosthetics that soldiers begin to use. We have no idea of how many Confederate soldiers underwent these same procedures and had to use prosthetics because most Confederacy records were destroyed. Another thing that we see come out of the Civil War, though, is the growth of the nursing profession. So there's such an influx of patients that the men called on to go fight and be in the medical tent, it's just not enough. And so there is an opportunity for women to fill in the gap. And you see a lot of famous nurses like Clara Barton or Dorothea Dix come on the scene. And what the Civil War allows for is for women to exercise a role outside the home. And this is going to influence how women behave after the Civil War. They're going to have a new sense of confidence and a new sense of agency to push for more rights and enter different professions, particularly the medical profession after the Civil War. But also it encourages the medical profession to look at the way they do things in a more scientific manner. They start saying, okay, we have all these soldiers from a battle. 5,000 guys have been wounded. We need to get through them as quickly as we can. How do we do that? So they develop an ambulance corps that sorts the wounded, bases them on priorities, who needs to go into an emergency operation now, who can wait a few minutes, who is going to recover if we just kind of throw a bandage on it. So they really think about how to prioritize. They think about severity of wounds, and largely women are at the forefront of making those decisions. Now, the surgery and the medical profession is going to receive its most pivotal change in the late 1800s, and that is from a man named Joseph Lister. Is anybody familiar with that name? You may have heard it before. It's associated with something that we call germ theory. Some of you may have used a product this morning that is named for him called Listerine, which is an antiseptic mouthwash designed to kill germs and bacteria. So I mentioned that in early medical practice, they thought that a lot of illnesses came from good and bad humors. And they also thought that contagious disease was the product of something called miasmas. And basically it's a bad smell. They thought that most diseases are contracted through a smell. And so if you're on the battlefield and you can smell death around you, that could bring disease. If you're walking by a stagnant pool of water and it smells bad, that's disease. And so there was this thought of if we maybe purify the air and make it smell a little bit better, people won't get sick. And that's not true at all. That's not how disease works. I mean, we do have some airborne contagious diseases, but it has nothing to do with our sense of smell. And so Joseph Lister was a surgeon's assistant at a hospital in Scotland, and he was in charge of a surgical ward. And he was perplexed by this problem of many of his patients die. About 50% in post-operative care end up dying. And their wounds become horribly infected and they're pus covered, and he's trying to figure out, where does this pus come from? What is its purpose? And why are my patients dying? And there were some different theories at the time when surgeons would perform a surgery. Oftentimes they didn't cauterize the wound. Suturing was brand new, and it was very controversial. A lot of doctors thought that, no, you need to let a wound after you perform surgery, let it be exposed to the open air, and it'll heal up, quote, sweetly. And so he's trying to figure out, why do those wounds that are left to heal nicely or sweetly keep getting infected? Where's this gangrene stuff coming from? And so he reads the work of a French biologist named Louis Pasteur, who did a lot of research on microbiology, and he discovered these microbes, bacteria and germs. And so he thought, well, what if there's some kind of microscopic cause to all of this? And so he looks under the microscope at some of the secretions coming from his patients, and he sees all these little creatures running around in the fluid. And so he decides, okay, yes, there is a cause here. It's microscopic, but there is a cause. Now, what can we do to kill these things? And so he kind of takes a Thomas Edison approach, trying everything he can that would work. Try vinegar, try water, try milk, try all these different things. What's going to kill these bacteria? And he eventually settles on something called carbolic acid that kills the bacteria. And so he decides to perform an experiment in his surgical ward. He starts dousing the patients after they have an operation with this carbolic acid solution. He mists it in the air, and he tracks the data on it. And in the 1800s, we see this first thought of let's do some studies. Let's look at statistics to figure out what's working and what's not. And so what he determined is, before he employed this method, he was losing about 46 to 50% of his patients. After employing this method, he's losing only about 15% of his patients, which is a huge increase. And he does some more tinkering with this. Well, what happens if I put this carbolic stuff on my medical instruments before I use them? The rate goes down even further. What happens if I boil them in water? Because Louis Pasteur discovered with pasteurization that heat kills these things. It reduces the rate even further. And so he has these ideas, he starts publishing them in medical journals at the time, that what we need to change our practices. We need to start boiling our equipment. We need to sterilize it with carbolic acid. We need to make sure that we keep treating the medical wards with carbolic acid to limit flare-ups of these infections, and we will save patients' lives. Very revolutionary idea. How do you think it was received by the general medical public? Medical practitioners?
Probably not well.
Not well at all. They thought it was ridiculous. You're telling me that something I can't see, some invisible organism, is what's causing all this. It seemed like fairy tales to them. And so there is a lot of pushback, but he has a very high-profile case. Queen Victoria needs to have an operation on an abscess under her arm, and she contacts him. She had heard about his procedures and his very good success in his wards, and so she contacts him to come and perform the operations. He uses the carbolic acid. The queen survives, and a lot of young medical students took note of that, and they start implementing his practices in their hospitals in Britain. The United States, though, is much slower to adopt these ideas. He comes here in 1876 and he speaks at the Philadelphia Exposition in 1876, which was a large event commemorating 100 years of American history. President Hayes from our museum, he was in attendance at that exposition. So it's very possible he could have heard Joseph Lister speak. I don't know, but it is possible. And after he gives his presentation, this is what I found, this is the success I've had, the doctors in the crowd start laughing at it to his face. And so he goes on a countrywide tour to spread his ideas, but it's very, very slow going. And this is going to have some national consequences coming up here in a minute. I just want to contrast two things for you. So this is a work of art. It's from an American painter named Thomas Eakins. This is called The Gross Clinic. And it's not gross because the scene is gross, but it's the clinic of Dr. Samuel Gross. And so this is an operation in 1875. What do you notice about the operation site and the doctor? First off, how light is the room? It's very dark in there. Is anybody wearing gloves of any kind? No. How many people have their hands in there? Everybody. Now let's contrast this from a painting. In the next decade, same painter, he painted the clinic of Dr. David Agnew. What do you notice now?
Scrubs under.
Yep, everybody's wearing white.
Operating gowns,
Operating gowns.
no masks.
Nope, still no masks. You're right about that. Very well lit, and we even have a nurse in there now. And so you can see this huge shift that happened in just the course of about 15 years. But this is going to have an effect on national politics. James Garfield, president to serve immediately after Hayes, he was the victim of an assassination attempt. On July 2nd, 1881, an office seeker who was mentally ill, he thought that because he supported Garfield in his own way, he sent out all kinds of letters and postcards to people of his own volition. He thought that he should get a job for it. And so he contacted Garfield, hey, I want my job, I helped you get elected. I'm probably the reason you got elected. And Garfield kind of just ignored the guy. And so he waited for him at a train station in Washington, D.C. and shot him in the back. And he fell down on the floor of the train station. Now, I want you to keep in mind the floor of a train station is incredibly unsanitary. Everybody's walking around outside where there's all kinds of horse manure, because that's the main form of transportation, horses. And they're just walking around. So he falls into this. And so the president has been shot. He falls down. And what do people want to do? They want to help. And so doctors start showing up from all over Washington, D.C., and each one wants to come and save the president. And so each one of these guys reaches into his back and feels around for the bullet. He had 9 doctors feeling around in his back. None of them are washing their hands. It's an emergency situation. And so he's going to be taken back to the White House. And one of these doctors who ends up taking charge is a guy named Dr. Willard Bliss. His first name was literally Doctor. So you can tell what his parents wanted him to be when he grew up. But Dr. Bliss takes charge, and he is going to find this bullet. And so he keeps probing the wound again and again. He feels inside. He can feel Garfield's fractured rib cage inside. He can't find the bullet. He gets this porcelain probe thing and pushes in even further. He still can't get it. And Garfield starts to go downhill very, very quickly. He starts getting sick. And so Dr. Bliss's prescription is he's starting to get nauseous. Well, we need to change your diet. You need to start eating bacon, steak, and potatoes. Those are all the things you want to eat when you're feeling, sick and squeamish. So he's bedridden. He starts getting nauseous from the heavy foods he's eating. He starts throwing up a lot. And so the prescription for that is let's give him whiskey, rum, and brandy. This is not helping, and he's further in decline. He feels terrible. He's in incredible pain, and he's received no anesthetic for any of this. All this probing he's doing, he's just bearing it out. And so Dr. Bliss puts him on morphine, keeps giving him whiskey, rum, and brandy, hooks him on morphine. And so he starts developing these very large infected sacs of bacteria that Bliss has to start draining periodically. And so he is in incredible pain, and Garfield's personal doctor is trying to get in the room to take charge of this, but Bliss is very kind of politically minded. He's pushing this guy out. He wants to be the person in charge that saves the president. So the president is languishing away for months, and one man comes in to try to help. It's a young inventor named Alexander Graham Bell, inventor of the telephone. He invented something that we'll later call a metal detector. And so he pleads with Bliss, I can find this bullet. We can figure out where it's at. Let me run my metal detector over him. And Bliss is very reluctant about this, but finally he agrees. And he says, okay, the bullet, we know the bullet is on the left side. You can only do it on the left side. And so he goes in. Garfield is laying on a metal spring bed. So when Bell does this, he hears a pinging the entire time, and he can't find anything. And Bliss's response is, yeah, see, this was a dumb idea, and it's not going to amount to anything. Garfield is going to end up dying in September after suffering 3 months at the hands of his doctors. Now, there are thousands of Civil War veterans at this time walking around with bullets embedded in their bodies. They are fine. Odds are that he would have been fine. Leave the bullet in there. What ended up killing him was the doctor's endless probing. What they find when they perform an autopsy on him is the bullet is not on the left side where Dr. Bliss swore that it was. It was on the other side where Alexander Graham Bell was not allowed to probe with his metal detector. And so this is a wake-up call for everyone that germs are a thing. And this has consequences. And so contrast this to an operation that President Grover Cleveland would have a little more than 10 years later, where he has to have a tumor removed from his mouth. He's in a very sterile setting. Doctors clean the room, fresh air. They end up removing it. They sew him back up. They give him the carbolic acid treatment. He recovers in a matter of days. And so just in a decade, you see this huge shift. If you're interested in that topic of James Garfield, I highly recommend this book. It's called Destiny of the Republic by Candace Millard. And this was turned into a PBS documentary that's very, very good called Murder of a President. I highly recommend both of these. They're very informative. The last issue I wanted to touch on is medicine and the mind. How did we deal with mental illness in the 1800s? Well, coming out of the Enlightenment period in the 1700s, there was this emphasis on reason, right? The mind, we need to understand the world through reason and rational thought. Well, if someone has struggles with rational thought or behaves irrationally, well, that person must not be human. They must be subhuman, was the thinking. Because the essence of humanity is the ability to reason. So people with mental illness were treated like animals. They were put in, oftentimes in the generic prison. Oftentimes they were chained to walls, and they were just left there. There was no kind of care or treatment. Now, in the 1800s, some religious groups, particularly the Quakers, thought that this is entirely inhumane, and these people will be able to improve if they're given good conditions. And so you see the creation of asylums that will end up being called lunatic asylums that emerge throughout the country. Places that are comfortable, places where the staff cares for the people living there. They're allowed to go outdoors. They're allowed to do hobbies and crafts and things that are beneficial. As the medical profession tries to understand, well, what is the root cause of mental illness, they think that the answer has to be anatomical. And so this whole pseudoscience emerges called phrenology, which is, let's map the brain, and you can see this head here. Well, certain parts of the brain control certain behaviors. And so if you're mean-spirited, it's controlled right here. If you're slow of speech, that's controlled here. If you're too opinionated, and this was particularly an accusation leveled against women. Speak out too much. If you're too vocal, that's a problem right here. And one of the solutions is, well, we need to alleviate the pressure in that area to give somebody balance. So you see trepanning used as a practice. And I have a trepanning set over here you can look at. That is, they would drill a hole in the head to try to relieve pressure on whatever area that they thought was a problem. This whole concept ends up getting grossly distorted as a justification for the superiority of certain races, particularly the white race against other races, that the brain is shaped different, and we can scientifically prove that. And that becomes a very popular mode of thinking in the late 1800s and early 1900s. Going into the late 1800s, a lot of asylums are fairly genteel. They're fairly respectful of their inmates, and they treat them mostly pretty well. President Hayes' sister ended up going to a lunatic asylum briefly. She struggled with postpartum depression, and President Hayes writes about her trip to the asylum was very good for her, and she's come back much healed from her experience of childbirth. But there are some asylums, particularly public asylums in large cities, where this is a problem. They're very underfunded, they have a ton of inmates, and one that was notorious was called Blackwell's Island. And it was an island in the East River in New York. Today it's called Roosevelt Island. But this was an island where New York decided, we're going to ship everybody that is an outcast to this island. Prisoners, they go here. The insane, they go here. The sick, the people with smallpox, and tuberculosis, they go here. The poor, there's the destitute that go to the almshouse, they go here. And so the asylum, which is actually staffed by the prison convicts from the building next door, so they're the orderlies, the insane treated here are just horribly treated. They are put 3, 4, 5, 6 in a room that would fit in this corner. When they get their outside time, they have to walk on these paths. If they deviate onto the grass, one of the orderlies comes to yell at them or sometimes beat them. And so one woman there's all these rumors about what's going on at Blackwell's Island, kind of filtering out into the public. And so one woman who wanted to investigate this, she was a journalist named Nellie Bly, very intrepid journalist. She decides to, in 1887, she goes undercover into Blackwell's Island. She pretends to be insane. And she writes about this in a little book. It's only 100 pages. It's super quick read, and it's very fascinating. It's called 10 Days in a Madhouse. She snuck in, she pretended to be insane, and she was surprised by how easy that was. The doctors just kind of looked at her and said, yep, you're insane. So there's no real firm criteria for who gets admitted and who doesn't. And, you got to think about that because, oftentimes family members committed other family members just to get them out of the way sometimes. And there's no criteria to prevent against that. So anyway, she goes to Blackwell's Island, and she's just appalled by what she sees. They're all the inmates are lined up for bath time, and there's a wash tub, and 100 inmates file through, and they get poured a cold bucket of water on them, but they keep recycling the same water for every inmate. And once a week, that's bath time. And they don't really get a chance to warm up or dry off. Their cells are cold. They put the very violent of the mentally ill inmates in with the people who don't exhibit violence, and so those people end up getting hurt. And so to kind of hide this from the authorities, the administrators shift things around. But she is able to get out. She had it worked out with the owner of the paper, Joseph Pulitzer, to get her out after 10 days. And this does expose this to the public, the conditions there. And this kind of creates more public awareness about how asylums are treating their inmates. And there's a push for reform for mental institutions in the 1900s because of this. So that kind of rounds out my talk. I didn't really talk much about disease, but disease was ever present. There's always a smallpox or cholera epidemic popping up. If we lived in the 1800s, all of you would know somebody or have a relative that died in a cholera epidemic or a smallpox outbreak or caught tuberculosis. But that kind of rounds out my talk. Any questions from you guys? I have one more book recommendation if you are interested. It's on the surgical aspect in Joseph Lister. It's called The Butchering Art. I think the subtitle is Medicine in the Victorian Era. But The Butchering Art by Dr. Lindsay Fitzharris is very, very good. You had a question? Yeah.
I was wondering why they decided to wear white clothing. At one point you mentioned how the medical school started doing that. Is there a reason for that?
Because it looks clean. If you would have gone into the medical profession, or if you would have gone in for surgery, the surgeon would have been wearing a butcher's apron, and it would have been completely bloodstained, and that terrified people. So what they would end up doing is that they'd swap it out with a clean white, white scrubs and a clean white apron to calm the patient. Then. Yeah.
You said it was the mid-1800s or 18th century that they started medical schools, correct?
Yes, in the mid 18th, Europe is a little bit ahead of us. I think there's a couple that show up in the 1600s in Europe, and then the very first ones are formed in the United States in the late 1700s.
When they started the schools, how long did the doctors have to go to school? And was it like it is now at all?
That's a very good question. I do not know how long they would attend. A lot of these programs they thought of the medical profession as any other trade. So, if you were going to be an iron worker, you were going to be a blacksmith, whatever it would be, you learned the trade. And so they approached it as an apprenticeship. So there is some schooling. I don't know how long that was, but then they paired you with a doctor, and you became basically a journeyman, or apprentice, and then a journeyman with a master doctor. I do not know how long that process took, though. Yes.
Did they use herbs back in that time period?
Mm-hmm.
They did, we came in late. I didn't know.
Yeah. Yes, they did.
Covered that.
One thing that was commonly prescribed, and I didn't mention it, was something called digitalis, which is derived from the bark of a tree. And they observed that if someone is having erratic heartbeat, heart palpitations, it can stabilize the heart rate. And they would prescribe that for people having heart attacks. such. So yeah, they used herbs for a lot of things. All right, well, thank you guys very much for having me. I hope I didn't gross you out too much. And if you want, feel free to check out some things from our medical collection.